for a long time, I've been thinking about providing this dental insurance kind of thing. When I first came to India, I always felt, we needed good coverage. We already have regular Mediclaim. We have vision to some degree, and then dental was something which was something we always use, but we just go to different hospitals and we just get it done as and when is required. And if it is not required, we don't even go. So then I was thinking about it, and I asked Mr. Ramakrishna actually, since he's a good friend of mine, and I know him for a long time now, and come up with some program which is tailor-made for us, which all employees can use, so we don't have to worry about going to different hospitals. They have your record and everything. And then I know that everyone has maybe very young kids now, and all the kids for the most part now need braces. So I just felt maybe we come up with a customized program. And then when I was talking to Ramakrishna, I realized that there is something called Smilsurance, which is pretty much catering to these needs for corporates. So then we tried to tweak it a little bit to fit our scenario, so that all of you can avail the benefits. The way the program works, probably I'm sure Mr. Ramakrishna is going to explain to, or someone else is going to explain to you. But the idea is, to make sure that we provide a periodic checkup for you, and then make sure that if there's any problem, regular scaling is done, and if there is any problem or anything which you need to get done, obviously we'll work with the hospital directly. But at least we would like you to go to hospital regularly. That's the best thing, right? That's a preventive care what we'd like to do. So that's how this program has been really conceived for the Hackett group. I'm sure they've been doing with other companies, but for Hackett group, that's what I wanted always. And personally myself, I don't think I ever used my insurance, the health insurance, but I always felt that I needed some insurance for my teeth and everything. So that's how this program, so I had some selfish motive too. So I thought, it should be practical, and I really feel this is going to be very practical for us. So please, and also being the first time we introduce this program, so we may have to tweak it as we go along. Maybe we will be looking forward to receiving your feedback. Whenever you have some, feedback, let us know. We could actually route it through HR, route it through Ravi, admin, so that we can continue to refine the process and then make sure that it really makes a lot of practical sense for us. That's the idea. So with that, I guess I'll pass it on to Mr. Ramakrishnan. Thank you.
So this is Smilsurance. Is basically, it's not an insurance. Insurance is the program. This is called an assurance, what we say. Assurance is, if you follow up the regular, preventive protocols, and that will definitely make sure that nothing major, can happen as far as the dental healthcare is concerned. So before this, let me just brief up about the reason why we came up with this. In dentistry, in dental healthcare, in India, there is no insurance available. The reasons are many, but as it is, there is no insurance company will cover the dental things except the accidental related dental work. So, but in the last 15, 20 years, we have seen that a lot of families, they come back again after getting treated once for a major dental treatments, they come back again with the repeated problems again. So we understood majorly it's because of the lack of, I would say, regular checkup by a professional. So we felt there is a great need to push it, though there is no, the big insurance companies support, with some kind of a program that we individually developed here. So that's how the Smilsurance has come up. And I think all of you must have actually seen what is the pattern here. We call, the hospital calls yearly twice. We will be sending the regular reminders. We'll make sure that there is enough importance given by you to make up for that dental visit, and then see that the whole things, the comprehensive examination will be done, and make sure that any small things will be attended at the early stage, so that the things will not come to the major things and will not involve, the lot of time from your active life. So this is in brief about Smilsurance, but we also probably have to understand why is that we need to actually have a dental health checkup regularly. I think most of us, I think probably you have seen a dentist all this by this time. Uh, our experience in the last 20 years is pretty clear, and this is on average every family once in 2 3 years they end up on each member almost spending around 20 30 minimum 20 30,000 rupees and some kind of a work. So I'm sure with a regular checkup, we can try and avoid the major expenses. So having said that, this is the place we started recently. We are already there in the Panchagutta in last 20 years. So this place has got a lot of its own, unique features. It has got a probably in single place biggest infrastructure in dental health care in India. We also have some experience of, extending different activities here, not just only curative and little social and preventive stuff around.